Hello everyone, my name is Dr. Amrish Bhagol and I am working as Associate Professor, Department of Maxillofacial Surgery in the University of Health Sciences, Rohtak, India. First of all, I would like to thank ITI for providing me this opportunity. I have chosen this topic if the socket shell technique is better than conventional immediate implant placement in the maxillary anterior region, as this is one of the most controversial topics in the field of implant dentistry. Moreover, many implantologists all over the world, they want to work on this topic. This is my workplace. It is located in a beautiful city, approximately 50 miles from our national capital, New Delhi. So in today's presentation, we are going to discuss a brief introduction to the topic, problem areas of dental implant therapy in anterior maxillary area, and possible solutions. Available literature on the topic, result of the study conducted at our center, discussion and conclusion part. The importance of this topic can be clearly understood by the fact that ITI has published various issues on this topic. I would like to start my presentation with a clinical picture of few of our patients. When we asked these patients about their treatment expectations, believe me, all of them had a similar kind of reply. They all want good aesthetic results, shorter treatment duration, and cost effectiveness. As we all know, dimensional changes of the alveolar ridge following tooth extraction remain a persistent challenge in implant treatment. Especially in the aesthetic areas, the preservation of peri-implant tissue has become the biggest challenge in the field of implant dentistry.